Hi, I'm Camille Roby. I'm coming to you from Section 1, Term 2, from Professor Lukowski's class with Adult Health 1. Today I'm going to be demonstrating the basic IV insertion procedure. So at this point, before I even enter to the patient's room, I would have implemented a standard protocol, which would include me checking my MAR against my physician's orders. And this is just to make sure that the patient matches the actual order and procedure to be done for that particular day. I would have also checked to make sure that if there's any other procedures such as blood transfusions or any blood products to be received, I would have made sure of that as well. And any known allergies that this patient would have had, I would have confirmed. And once I enter into the room, I would have reconfirmed that as well. So now that I am entering into the room, I will go ahead and introduce myself to Mr. Jones. Hi, Mr. Jones. How are you today? I'm Camille, and I'm going to be your student nurse for today. So from this point, I will go ahead and do my two identifiers just to make sure that this is the correct patient and it matches the correct procedure. So I would have asked him to please verify his name and his date of birth against his wrist or his armband. So from that point on, I can go ahead and proceed with my actual basic IV insertion. So from this point, I would have gone ahead and made sure that I have all my equipment, my supplies, upon which I do. I have my gloves, I have my alcohol swab, my alcohol or hand sanitizer, I have my gauze, I have my Tegaderm, I have my pen for documentation. I also have my sterile INT extension, which is already pre-prepared and sterilized, as long as my 10 milliliter syringe of normal saline. I also have my 20 gauge needle, which I would be using for the IV therapy that has been ordered. If it was to be for a blood transfusion, I would have used an 18 gauge, but instead this is a 20 gauge, which has been ordered. So at this point, I'm going to go ahead and I'm going to sterilize my hands or sanitize. And so now I'm going to go ahead and put on my clean gloves before I go any further. And again, since I have prepared all my my supplies, I'm going to go ahead and gather my 10 milliliter syringe out of its sterile field along with the INT that I have already prepared, and it already has the clamp on there. So I'm going to go ahead and unclamp it because I want to prime it to make sure that it works. All right, and it does work. So I'm going to go ahead and reclamp that back. And then I'm going to place it back into its sterile field. So now at this point, I'm going to go ahead and now that I have sterilized, I'm going to go ahead and assess this patient's arm. So at this point, I would have asked Mr. Jones what is his most dominant arm. So in this case, his right arm is his most dominant arm, so I would do his left arm, which is non-dominant, to select that vein. So now I would begin at the most distal point of the arm, that non-dominant arm, and I would work my way proximally up to make sure, as I'm choosing my vein, that vein is also soft, resilient, and bouncy, and that it is also large enough to receive the 20 gauge catheter that I have selected, that the doctor has also selected as well. And as well, the arm looks clear. There's no infiltration, there's no infection that is in this way, and this actual site of this arm that I have chosen, this vein, it is not in the way of any ADLs that this patient may be doing on a daily basis, as well as any planned procedures that may have been scheduled for that day. So after I have done that, now I'm going to go ahead and grab my Tegaderm, and I'm going to tie it in a quick release knot. And I'm going to do so away from the actual site, specifically about 4 to 6 inches away from the actual venipuncture site. Okay, so now I can go ahead and gather my alcohol swab. And I'm going to go ahead and I'm going to clean the area, covering very rigorously, cleaning this area, covering all areas of where my actual tegaderm is going to be placed. Alright, so now that that is drying, I'm going to go ahead and I'm going to gather my 20 gauge needle that I had from the very beginning, and I'm going to go ahead and I'm going to insert my with this 20 gauge needle in the actual vein site, and I'm going to do so at a 15-degree angle with the bevel up. So, and I'm going to go ahead and I'm going to pull the skin taut away from the actual venipuncture site as I do so. And so now I'm going to go ahead and insert, popping the vein. Alright, now that I have felt it pop and I see blood flash back into the chamber, I'm going to go ahead and lower my needle to a 10-degree angle. Okay, and so as I do that, I'm going to go ahead and advance the actual catheter additionally to another 1/8 to 1/4 inch of the way, all the way until the hub is resting at that venipuncture site. Okay, so now that I have done that, I'm going to go ahead and apply pressure about 1 inch away from here with my index finger. And as I do that, I'm going to go ahead and pull out my needle. And I'm going to, this will go in the sharps container as well. And so now I can gather my already prepared INT extension with my normal saline. Alright, and I'm going to go ahead and attach. Okay, with the clamp still on. Alright, and so now I'm going to go ahead. I'm going to go ahead and release that. Alright, as I'm still holding pressure, I'm going to go ahead and I'm going to aspirate and check for blood return, upon which I do see blood return. So now I can go ahead and administer my 3 milliliters of normal saline solution. And I'm going to do so with the stop-go method. 1, 2, 3. And on this third one, I'm going to go ahead and put the clamp on. Alright, just going to go ahead and put that, the clamp is on. Alright, so now that I have done that, I'm going to go ahead and gather my tegaderm. And I'm going to cover with my tegaderm all areas of where that hub of the venipuncture site is placed. And this is just to ensure that no microbes enter at this site. So I'm going to press down in all areas. And so at this point, now that I have actually placed my tegaderm, at this point I would have gone ahead and labeled with my initials, the date and the time, an actual site of where I placed this venipuncture. Okay. I'm just going to put so on this side, and that is to ensure the actual date and the time of when it was placed on here. Alright, so now at this point I can go ahead and release, now that the clamp is on, I can go ahead and release my 10 milliliters of normal saline, and then I can go ahead and finish stabilizing these actual INT with my tape. Alright, so now after doing that, then, as I said before, I would have disposed of all cap needles into the sharps container, and then I would have made sure that all of my documentation is done. So now that that is done there, then I can release my tourniquet as well, which I would have done this before now, I would have released the tourniquet as soon as I put it into the actual venipuncture site. Alright, so now that I have done that, then I can go ahead and just make sure that everything looks good, everything still looks well. So now that I've done this, I'm going to go ahead and enter into my documentation stage. And so at this point, I would have documented the date and time, I would have initialed it, I would have put the actual location of where I've done my venipuncture, which in this case, it was the left forearm. Any further instructions that I may have had from Mr. Jones, I would have done so and documented that as well. And so at this point, this would have completed my protocol.